Hello, thank you for joining us. We are here from DECA to talk about National Prevention Week. Today's topic is preventing marijuana and other illicit drug use. Joining me today is Deanne Armstrong from DECA. Thanks, Deanne, for joining us.
Glad to be here.
So what is your role with the organization?
So I've been with DECA nearly 9.5 years. I'm a community support specialist and a training consultant. And I provide training and technical assistance to communities in the Northeast region of the state. But I'm just one of many part of a prevention team at DECA. There are community support specialists for each region throughout the state. And we really help communities use a scientific approach to do strategic planning for effective prevention work in their communities. We believe that local people solve local problems best. So it's really our hope to empower and equip communities to be successful in planning and implementing prevention efforts. And we want them to work smarter and not harder. So using their efforts in the most effective way by using scientific approaches that have been proven to work.
Great. Well, we appreciate your work on this topic in this area. And, why would you say prevention is important of marijuana and other illicit drugs?
Well, first of all, illicit drugs refer to highly addictive and illegal substances such as heroin, meth, cocaine, ecstasy, hallucinogens. But the most commonly abused illicit substance is cannabis, or marijuana, as we often hear it referred to. And I'm passionate about preventing anyone from ever starting using any of these substances because they can so easily lead to addiction, legal problems, loss of mental or physical health. A lot of times people lose their families or relationships, causes really tough financial hardships, sometimes even homelessness. And just overall, the loss of the joy of a thriving and productive life. So they say that an ounce of prevention is worth a pound of cure. And I believe that. I think if we can work upstream to prevent those negative effects forever happening, that's where I want to invest my time, energy, and resources. And I want to help others to know how to do that same thing.
Great. Describe ways substance abuse can be harmful.
Oh, it can be harmful in so many ways, Alex. An addiction to illicit drugs really just changes the way the person's brain works, and consequently that will change the way they think and the way they act. So they're just not the same person anymore, and they don't make the same choices. Many types of illicit drugs pose really serious health risks, even when they're taken in small doses. Some drugs can cause addiction after even just one single use. People who become addicted to certain illicit substances are at a really high risk of overdose, which can be fatal. So there are many overdoses occur for different reasons, but sometimes even during recovery. Maybe someone's on their recovery journey and they have a situation that comes up that they feel like they relapse and they use again, and they think that they need to use at the same amount that they did before they quit using, and that they take that same amount and their body's not used to that anymore and they overdose, and that's just really a sad thing that happens. Sadly, also, there's just a number of deaths related to heroin and other opioids, and that has substantially increased in the last decade. From like 2002 to 2017, the number of opioid-related deaths grew more than 4 times. And just during this last year, during this pandemic, there's been a significant increase in fatal overdoses. A lot of that has been driven by the use of illicit fentanyl, which has gone up 38% during this pandemic. So those are alarming statistics to me, and that makes prevention work to me really urgent. Cannabis use is still illegal federally, and it's illegal in Kansas, and in all 50 states it's illegal for minors to use recreational marijuana. But society sends such a mixed message about this, and so it's so confusing for people, and particularly youth. And THC, which is that main psychoactive compound in cannabis that produces that high sensation, is not harmless. And it's addicting. And the potency level has changed so much. From the 60s and 70s, it was really uncommon to hear about anything that was over 5%. And now just the common street weed is 15 to 20%. And some of those concentrates are as high as 70 to 90% concentrate of THC levels. So that's alarming to me. And just one more statistic about that 1 in 10 users can become addicted having a cannabis use disorder. And those numbers for somebody who starts using before the age of 18 increases to 1 in 6 to become addicted. So that's another just really alarming statistic to me that makes prevention work so important.
Definitely, that is very alarming statistics. Like you said, that is very shocking news to hear for a lot of people, and a lot of it is, can be prevented. And so I think that's what we're trying to do. And what would you say are some resources that are available from DECA to help prevention for substance abuse?
We have multiple resources to provide education and tools, whether you're an individual looking for information or a community. Coalitions can be very powerful in a community to prevent substance use and decrease the risk factors around substance use. So we have human resources, the community support specialists and others on the prevention team. We have e-learning modules and toolkits on many different subject areas. And we have many training opportunities. And some of the examples of those training opportunities I'd like to highlight are the third Thursday of every month at 10 o'clock. We have an hour-long free prevention skills virtual training, and it is on different topics every month. May the 20th is our next one from 10 to 11, and the topic just happens to be marijuana. Another popular training is our naloxone trainings. So we talk about opioid epidemic, the history behind it, awareness of opioids, how to prevent opioid misuse, and then how to administer that the overdose reversal drug known as naloxone or Narcan, you might hear it. That is it counteracts the life-threatening effects of an opioid overdose. So you can sign up for those free trainings. You can request TA or specific trainings. You can get free safe disposal resources to get rid of unused medications in a safe manner. And you can also get free naloxone kits by going to the DECA website, which is DCCCA.org, and just look on the Kansas Prevention Service page, and you can find lots of resources there.
Great to hear, Deanne. Thank you so much for that. And how can others participate in prevention efforts?
Good question, Alex. I think the first thing that I would really recommend is, if you're interested, go to those websites, the DECA website. There's lots of other great websites out there to get educated on. But then find in your community, is there already a coalition or a group that exists that's working on prevention efforts, or maybe they have an interest in how they can work towards decreasing a substance misuse problem that they identify in their community. Also exciting news, the Kansas Department for Aging and Disability Services, known as KDADS, is a state agency that we get a lot of our funding from. We're contracted to provide prevention training and technical assistance through the block grant that they provide to us. And they're going to be releasing a new a grant opportunity for coalitions that want to develop that strategic prevention plan. They have a year of planning that they get funding for, and then after that they have funding to implement their plan. So I would talk to your community support specialist in your area about that opportunity. It says behavioral health training and technical assistance. You can find a regional map and it'll have information about contacting the community support specialists in your area.
Perfect. Thank you so much for providing those resources, and thanks for your time today, Deanne. And I really appreciate you laying out some great statistics and some educational materials for folks out there, like they can find some other prevention efforts on their own.
Yeah, I'm excited. I'm glad to be here with National Prevention Week and celebrate prevention. We believe in it, and we hope that more people will jump on board with us.
All right, sounds great. Thank you so much again for your time, and thank you everyone for joining us today as we discuss National Prevention Week. Stay tuned throughout the week as we'll have plenty of resources and education out there for you to check out. Thanks a lot. Have a good day.